Brian is here to talk about insect stings.
Insect stings are common and usually cause only minor irritation. However, some stings can be painful and trigger a serious allergic reaction. In the UK, insects that sting include bees, wasps and hornets. An insect sting often causes a small lump to develop, which is usually very itchy. A small hole, or the sting itself, may also be visible. The lump may have an inflamed area around it that may be filled with fluid. This is called a wheal. Stings usually clear up within several hours and can be safely treated at home. A wasp or hornet sting causes a sharp pain in the area you are stung and usually lasts just a few seconds. A swollen, red mark will often then form on the skin, which can be itchy and painful. At first, a bee sting feels similar to a wasp sting. However, if you are stung by a bee, it will leave its sting and a venomous sac in the wound. You should remove this immediately by scraping it using something with a hard edge, such as a bank card. Do not pinch the sting out with your fingers or tweezers because you may spread the venom. Most people will not have severe symptoms after an insect bite or sting, but some people can react badly to them. You are more likely to have an allergic reaction if you are stung by an insect. A minor localized reaction to a sting is normal and does not require allergy testing, although the affected area will often be painful for a few days. A large localized reaction can cause other symptoms such as swelling, itching and rash. A systemic reaction often requires immediate medical attention as it can cause a potentially life-threatening allergic reaction. If you have a large localized reaction after being bitten or stung by an insect, a large area around the bite or sting will swell up. The area may measure up to 30 centimeters, 12 inches, across, or your entire arm or leg could swell up. The swelling will usually last longer than 48 hours but should start to go down after a few days. This can be painful, but the swelling will not be dangerous unless it affects your airways. You may have large localized reactions several hours after being bitten or stung. This could include a rash, nausea, painful and swollen joints. For information about insect bites, click the link in the description. The link will take you to my video explaining insect bites. Sometimes, an insect sting wound can become infected with bacteria. Signs of infection include pus collecting around the wound, redness spreading from the area, increased pain of the wound, high temperature, chills, swollen glands. Sometimes, insect stings can cause anaphylaxis, which is a severe, potentially life-threatening, allergic reaction that can affect breathing. Signs of anaphylaxis include breathing difficulties, dizziness and giddiness, skin changes, such as itchy skin, or a raised red rash, sudden diarrhea, vomiting and stomach cramps. If you suspect that you, or somebody else, is experiencing anaphylaxis, you should dial 999 for an ambulance and tell the operator that you think anaphylaxis has occurred. Some people with a previous history of anaphylaxis will have an auto-injector of adrenaline. This should be injected into their thigh muscle and held in place for 10 seconds. Click the links in the description for more information about caring for wounds and wound infections, and for more information about anaphylaxis.